So yes, we start all about epiglottitis today. This is a very important topic for the NCLEX. So I'm pleading with you that you stay right to the very end so you'll be able to grasp all about epiglottitis. So let's dive right into our introduction. So one may ask, what is epiglottitis? So it's simply the inflammation of the epiglottis. So as you see the word itis means inflammation. When you see the term tonsillitis, it means inflammation of the tonsils. So epiglottitis also means inflammation of the epiglottis. And is a very important topic that you must know about because it can lead to severe upper airway obstruction. It is a medical emergency and it requires immediate medical attention. And you know, in testing for your NCLEX exam is all about being a safe nurse. So you should know all about epiglottitis because that will also make you a safe nurse. So a bit of the anatomy of the epiglottis. It is a leaf-shaped flap. So it's a flap of cartilage and it is located at the base of the tongue. So see where the tongue is here and you have this leaf-shaped flap is made up of cartilage and is located at the base of the tongue, just at the entrance of the larynx, that is the voice box. So it is a very important structure. So see where it is located. So you have the larynx, so the airway comes here, and then see we have the esophagus. So it serves as a flap which can block the passage for the airway so that as you are swallowing your food down the esophagus, it doesn't get into the airway. So the epiglottis is a very important structure. So yes, with a function, it acts as a switch between the trachea, that is the airway, and the esophagus, as I said earlier on, and it will ensure that foods and liquids are directed into the esophagus and it will allow air to pass into the airway. So take note of that important function of the epiglottis. So by way of its function, we can deduce that yes, it really protects the airway. Look at where it is located. So by closing off the trachea during swallowing, the epiglottis will protect the airway from aspiration so that the food will not get into the airway. And then it will prevent foods and liquids from entering the trachea and reduces the risk of choking and respiratory infections. So how will this child present? How will the child with epiglottitis present? You will have a child presenting with sore throat and being unable to swallow. So sore throat and being unable to swallow. And it can lead to complete airway obstruction within 2 to 6 hours. So that's why it is very important to know about epiglottitis. And interestingly, the onset is sudden in a previously healthy child, and the age group will mostly be between 2 to 5 years old.